We're going to take our viewers back to Washington, D.C. right now. Peter Cook standing by with a little bit more on the health care debate. Peter.
Well, Deirdre, President Obama says he is optimistic an overhaul of the health care system will get through Congress before the end of the year. Critics of the president's plans are concerned that the call for a public option will lead to government control of the U.S. health care system. Michael Leavitt served as Secretary of Health and Human Services under President Bush. He also served as EPA Administrator, and he, of course, was also a three-term governor of the state of Utah. He joins me now to talk about what's going on with the health care debate here in Washington. And you've called, first of all, thank you for joining us. Appreciate it.
Good morning.
And you've been opposed to this idea of a public option. You call it a Trojan horse. And walk me through your opposition to this idea, because the president again yesterday defended the idea of the public option, that this is the only way to force the insurance industry to really compete.
If you're an employer and the federal government says to you, I'm going to give you the opportunity to flee this market and you won't have to deal with the vagaries or the risk, that's going to be an appealing offer. The very respected economists have indicated that as many as 120 million people would lose the option for a private plan if there was a public option. That means that those markets become inviable and the private market disappears and we don't have any more competition. I think it is a Trojan horse. It's established essentially by those who advocate Medicare for all as a means of gradually getting there. They can roll this out and say, oh, it's just competition and choice. They clothe it in the language of competition and choice, but really it's a very direct path to a government-run health care system.
Democrats, I've heard Governor Dean make this case that you'll have a public option. Perhaps Americans will try the public option, find it's restrictive, go back to the private insurance industry. There is an opportunity for a hybrid here. You still don't believe that the two can work side by side?
I don't believe it's government's role to be in that place. I think the government ought to be organizing a marketplace that's efficient, where people have adequate competition. We have adequate competition, but the market is not well organized, and I think government ought to be taking strong action to organize a market so that the private plans can compete and give people real competition. Competition from the government isn't competition. It's domination.
Let me ask you about some of the ideas, the alternatives that are being floated out there and apparently gaining some measure of traction. This idea of state-based nonprofit healthcare cooperatives. Senator Conrad has pushed this idea. Apparently, again, the Senate Finance Committee is giving this strong consideration. The president hasn't necessarily ruled it out. Would it work?
Well, if co-ops were constructed in a way that allowed for state regulation as opposed to federal regulation, if the federal government wasn't in the position of appointing all of those who would govern them, if it could become real capital that's being deployed in a way that would provide competition. I don't particularly understand the difference between a co-op and, say, a nonprofit Blue Cross plan, but it has possibilities, but it really boils down to whether or not the federal government is going to operate it, capitalize it, and control it. If it does, it ends up in the same place as Medicare for all. One of the things that I think providers need to be concerned about is whether or not Medicare reimbursement plans are being used. If it is, I think that's a big problem for hospitals. It's a big problem for doctors, and ultimately they'll come to that conclusion.
Let me get your sense right now. As we sit here today in Washington, this debate taking place, how does this end? Do you think we get a deal this year, and is it a bipartisan deal?
We're still not talking about the $64 trillion question.
How do you pay for it?
How do you pay for it? The president has suggested we'll have $300 billion worth of reductions in Medicare costs. 2 years ago, I took a $158 billion package of reductions to the Congress. I was politically stoned by the party now in control and, frankly, by members of my own party. You need to show me the money. I don't see how they pay for this. I think adding another $1.5 trillion on top of the stimulus plan, on top of TARP, on top of all the debt we've taken on, seriously endangers the economy of the United States. I think the public's going to understand that. I think there's great concern about it. They haven't yet begun to wrestle with the big question: how much does it cost, and how do you pay for it?
All right, Mike Leavitt, still weighing in on the health care debate. We appreciate your time. Thanks very much for joining us.